Functional medicine is patient-centered. It is inclusive of a patient's biochemical individuality, their physiological individuality, what's going on in their life. We ask more of why does somebody have these symptoms that put all together we give a diagnosis to, a diagnostic code. Functional medicine takes into account what we used to call confounding variables and what we dismissed as part of a diagnosis because they were, by definition, confounding variables. Well, what were those confounding variables? It's very similar to what happened with the Human Genome Project, where we found out that even though we thought that we would have 1 million genes, hundreds of thousands of genes, 100,000 genes, because we were such complex, intelligent individuals, turns out we have less genes than a good Pinot Grigio grape. Somewhere between 23, 24, 25,000. How could this happen? Well, there was a lot of material that was what we called junk DNA. Well, it seems that a lot of that junk DNA is where the action is. These variables, these confounding variables, include lifestyle, whether you sit on your butt all day long, are you active, your dietary choices. Let's not forget that the food that our grandparents ate was called food, not organic food. Our genetic inheritance, again, what we used to think was genetic determinism, we now find that your genes are not your destiny, that maybe they're 20%, maybe up to 25% of what's going on with you, but what affects them is the environment, toxins, your diet, your lifestyle. A lot of things are impacting together. It's sort of like a perfect storm the other way, where you may have some genetics that aren't going to be fatal early on, but they may show that you will have a propensity for having diabetes, heart disease, hypertension, certain cancers. Included in those variables are proven, pervasive, persistent organic pollutants, heavy metal toxicants, things in the air, mercury, lead, arsenic in the water, a few other things, issues with allergens. We're seeing people sicker, faster, earlier than we ever have before. We're looking at levels of chronic, low-grade, systemic inflammation. We know that chronic inflammation is a main component of chronic degenerative disease. Suddenly, we have levels of inflammation that we've never had before. Issues with immune system dysregulation, endocrine dysregulation, nutritional deficiencies. We know that the majority of us are insufficient or deficient in vitamin D. It's basically a sunshine deficiency. Magnesium, the relaxation mineral. So many things that are not in our foods anymore that used to be in our foods sometime around World War II. It's been 70 years where a lot of things have changed, including those toxins that we now have 80,000 or more chemicals in our air, our water, our food that didn't used to be there before. Functional medicine should not be thought of as alternative medicine. It is not substituting an herb for a drug. It's not substituting an acupuncture needle for surgery. It has to be thought of as a bridge to a more effective and safe chronic medicine model than we've had before.